Doctors and dentists around the country who are not involved in COVID-19 response efforts are trying to keep practices afloat and keep patients safe. Our national investigative team takes a look at the long-lasting effects this pandemic may have on private practice care. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
A dentist posts on social media asking patients to call anytime. On a typical day prior to COVID-19, you saw how many patients a day?
I'd say at least 25 to 35 patients a day.
And how many are you seeing now?
1 to 3.
Are you worried about surviving? Are you worried about being able to keep all of your employees?
Yeah, that's on my mind for sure.
While some doctors help treat coronavirus patients, many with different specialties are struggling.
Our main source of our income, not only for us, but for the families that we provide for and our employees, has been drastically just cut off.
Did you take a 25% pay cut?
Yes.
This Arkansas orthopedic doctor says his visits are down 65%, surgeries as much as 20%.
I've got colleagues across the country. Some of them have been completely laid off with no income. I've got physician friends and colleagues that have taken 50% cuts in pay. I've got some that have taken furloughs.
Dr. Jeff Angel says his practice will be fine, but some doctors expect the coronavirus outbreak to impact smaller practices not tied to hospitals.
I think as the financial aspects of practice continue to become more and more complex and more risky, you may see more physicians run to health systems and hospitals as a sort of safe haven to continue to practice.
It also might change how freely doctors see patients. More screening might take place before a patient is allowed to enter the office.
I think moving forward, there's going to be some longer term ramifications to bringing a quote unquote sick person into your clinic. So things are going to change.
Back in the dentist chair, Marco Farian worries about his practices in New Mexico and Michigan. He's one of 110,000 dentists nationwide who work with assistants, record keepers, and more. Many people losing money, with many offices now relying on the federal government to survive.
I applied for, these disaster loans that are available, and it's kind of wait and see. I haven't heard anything yet, so that will definitely help.
Up next, we continue to honor area athletes who have had their seasons cut short because of COVID-19.